Hello YouTube, I'm Dr. Fox. Today, I'm gonna talk about the emergency IUD, which is the most effective emergency contraception. Emergency contraception is an option if you have had sex without using any form of birth control or if you think your birth control method failed. The two forms of emergency contraception are the emergency contraception pill and the emergency IUD or intrauterine device. It is important to note that regular birth control is the best way to prevent pregnancy, but emergency contraception can still work well. Of the two types, the emergency IUD is the more effective. Okay, first of all, you may wonder if taking emergency contraception the same as having an abortion. Emergency contraception is not the same as abortion as it prevents you from getting pregnant in the first place by stopping you from ovulating, which is when your ovaries release an egg, stopping the fertilization of the egg or stopping the fertilized egg from implanting in your womb or uterus. Okay, so what is an emergency IUD? An emergency IUD is a small device made of copper and plastic. It needs to be fitted in your womb within 5 days after you had unprotected sex or 5 days from the earliest point at which you could have ovulated. You will need to see a doctor to have an IUD fitted, and this appointment will take about 20 minutes to an hour. The insertion of the IUD itself only takes about 5 minutes, but some women find it uncomfortable. Emergency IUDs are the most effective type of emergency contraception. However, if it can't be fitted immediately, you may be advised to take an emergency contraceptive pill. Okay, how do IUDs work? An IUD is small, shaped like a T and made from copper and plastic. It's fitted in your uterus or womb by a doctor. After it is fitted, it starts to release copper, and this prevents the egg from either being fertilized or implanting in your uterus. As a form of emergency contraception, you can have an IUD fitted as many as 5 days after having unprotected sex or the earliest point at which you could have ovulated. An IUD can then be left in and used as a regular birth control method. Next, how effective is the IUD at preventing pregnancy? Among women who use the emergency IUD, less than 1 in 100 will fall pregnant. This makes it more effective at stopping pregnancy following unprotected sex than the alternative emergency contraception option, the emergency contraception pill. Okay, next, can anyone have an emergency IUD fitted? The vast majority of women can have an IUD fitted, even if they have HIV. To make sure an IUD is right for you, your nurse or doctor will ask you about your health now and in the past, which is known as taking your medical history. Okay, what are the disadvantages of the emergency IUD? For a few days after IUD is fitted, some women may experience bleeding and pain, similar to what you would expect during their period. You can take pain relief to help reduce the discomfort. It is also possible, though rare, that you will get an infection in the first 3 weeks after your IUD is inserted. Your doctor may give you antibiotics if you have an infection when your IUD is fitted. An IUD can also move or be pushed out of place, but again, it is rare. Finally, there is a tiny chance that when the IUD is fitted, it could puncture your uterus. Next question. How will an emergency IUD affect your next period? After you have an emergency IUD fitted, you should get your next period at around the same time as you usually do, but it could be heavier than normal. However, if your period is late by a week or so, you should take a pregnancy test. Okay, what sort of follow-up do you need after having an emergency IUD inserted? 3 or 4 weeks after you have an IUD fitted, you should see your doctor. They will check you are not pregnant, discuss your future contraceptive, and remove the IUD if you don't want to keep it as your regular method. You can have your IUD removed when you have your next period, but if you get it taken out at another time, you will have to use other birth control methods like condoms or not having sex for a week beforehand. You may worry, what if you could be pregnant already? If there is a chance that you are pregnant, you should not have an IUD fitted. However, it is safe to have IUD if you are breastfeeding and your supply of milk should not be affected. Okay, next, where do you get emergency contraception from? Regardless of whether you are under or over 16, you can get emergency contraception from certain doctors' clinics. Importantly, not all of these places will be able to fit an IUD for you. Okay, last question. Will emergency contraception stop you from getting pregnant in the future? If you want to, you can keep your emergency IUD in and use it as your regular method of birth control. This will protect you very well from falling pregnant in the future. Just remember, the emergency contraception pill has no lasting effect. It works only once and you could fall pregnant unless you start taking birth control regularly. You will need to speak to a healthcare professional about birth control or future emergency contraception if you think you may need it. Okay, thank you for watching. See you soon.